Do you know anybody that has thinning hair or they're not happy with their hair, has low energy, can't lose weight anymore, dry skin, maybe some anxiety, brain fog? Of course you know somebody with that. It seems like 9 out of 10 people have those symptoms. I want to talk about thyroid conditions because they've exploded in the last 10 years, and there's a reason why. I would even argue after COVID, we've seen a massive increase, and there's a lot of reasons for that. Many years ago, I had every symptom I just mentioned. I went to my doctor, my blood work was normal. Hormones have to attach to your cells through a little receptor, just like your cell phone has to attach to a tower to get the message through. But what if there's a big cement wall or something blocking it, or the tower's too far, whatever, and there's no tower, your cell phone's useless. See, that's the same. Hormones, if it can't get to the receptor, the tower, they don't get in the cell. We don't feel well, despite having normal blood levels. Hormones have to get in the cell, connect to the receptor. So what if something's blocking it, like the cement wall? It doesn't matter. My blood work was normal. What if you go to your doctor, they do the test, and they say, oh yeah, you're out of range. Your TSH is out of range, your T4, T3. 2 months later, you go back, your blood work's so much better. And you're like, I don't feel better, because they didn't tell you that something's blocking your thyroid hormone, even though you're taking it, from getting in the cell. Or they didn't tell you that you have to convert it to an active form. And they didn't tell you that certain toxins actually block that. And they didn't tell you that certain toxins drive cellular inflammation and block the hormones from working. Oh, and it's not just thyroid. All of those symptoms are for something that I'm calling closed door syndrome. This is a pandemic of people that have these symptoms, and it's because they have inflamed cells. Oh, and the scientific literature says inflammation is the cause of all these different conditions, but we're not putting 2 and 2 together. That says, wait a minute, this is cellular inflammation. This is a cellular problem. 20 years of teaching this. I think if you're hearing my voice right now, you're saying to yourself, okay, great. I get it. That's why I don't feel well. I believe it, because I've been down the hormone route. I'm taking hormones. My blood work looks better. I don't feel better. Or I'm the person who went to the doctor with all those same symptoms that you just mentioned. No energy, can't make it through the day, anxiety, can't sleep, whatever. The point is, in your blood work was normal for now, just like mine. When the cells are inflamed, you can't get your nutrition in your cell to even make normal energy. Oh, and here's the worst part. You can't get the toxins out of the cell. So toxins build up in our cells and we make less and less energy. No wonder we have anxiety, because we're utilizing cortisol and adrenaline just to have energy. And no wonder we need stimulants to get through the day. The problem is hormone resistance, driven mostly by toxins. Vegetable, canola oil, corn oil that's in every food, even the healthy food we buy at Whole Foods, is also driving cellular inflammation. Stop that now. Stop those bad oils. Get to all the good stuff, right? The tallows, the fats, the real butters, the olive oils, avocado oils, coconut oils. Move to that. What about these toxins? Do you have silver fillings? Possibly a moldy home? Do you have hidden infections in your mouth? What makeup are you using? How much plastic are you drinking out of, storing food in? Are you spraying pests around your house? Do you have air fresheners? What are you washing your clothes in? Things like fabric softener. I walk down my neighborhood. I smell who has hormone disruption. I could tell you that this house right here, a lot of hormone disruption, probably gaining weight, and can figure out why. You know how I know what house? Yep, all the bounce and all the stuff. At least 6 endocrine disruptors. And when you put it on your clothes, it absorbs into your bloodstream, just like how we give transdermal hormones, and those hormone disruptors screwing us up. When you smell that stuff, are you using Tide or what you're washing your clothes in with all those fragrances? Guess what? Fragrance is one of the most toxic chemicals unknown to most people. You know why? They have something called intellectual property that protects them from even telling you hormone disruptors causing cancer, causing other problems, ban that they're allowed to put in those products. Fragrance is that lethal. They're putting banned cancer-causing, hormone-disrupting substances that have probably been banned for 10 years in the products. The fabric softener, it's in the laundry detergent. You might even be washing dishes in it. I probably just overwhelmed you. Okay, but here's the good news. If you just do the big things, stop bringing these toxins in your house. I mean, please don't plug in air fresheners. It's 2025. We have a lot of choices. Buy organic food when possible. If you can't afford it, eat from the Clean 15 and avoid the Dirty Dozen. There's no excuse. You could have a $300-400 RO system not to drink city water loaded with hormones, chlorine, fluoride, because chlorine and fluoride are called halogen chemicals, and they bind literally to thyroid receptors, blocking the hormone. All these toxins I'm talking about make their way into the cell because your cell membrane is fatty and it drives inflammation, blocking your hormones, closed door syndrome. You don't feel well, nothing works. What I'm saying is deal with the big things. Stay tuned to my channel. If we we can absolutely change this. We're going to change the health of our family. We're going to change our hormone health. And yes, we're going to impact our thyroid. Why do you think thyroid cases have exploded in 20 years? Because the level of toxicity is like no time ever in the history of man. The amount of toxins that we're taking in 10 years ago, 20 years ago, you could tell someone to lose weight, change their diet. Today, 50% of you watching me right now have already done that and you're not losing weight. Am I right? 50%, maybe 80% of you have already changed your diet, started buying organic, doing some of the things I'm mentioning, still don't feel well because, see, these toxins that I'm talking about are accumulating in our tissue. And that's why my cellular detox is, I believe, the real reason, or the real way, I should say, to get our lives back. Because the reason diet alone isn't doing it is because we have accumulated toxins in our cells. At least you can start with you and your family is avoiding what you're putting into your bodies, bringing into your home, wash your clothes different. What are you cleaning your counters with? Because that ends up in your food too. And all the fragrances in that. We need to make better choices. You're going to pay. Oh, you're going to pay maybe a little more for these things, but pay now or pay later. You and your family. You want health? You better start looking at the toxic load that we're accumulating in our tissue. That's really how we optimize hormones. If it were only so easy to just take hormones and we'd feel better. If that were working, we wouldn't have all the people at a party, you listen to them and they're talking about all their problems with the anxiety and talking about all this and all the gut problems. All of that they're doing isn't working. The fact is we better deal with the toxins coming in, and I believe you better deal with it correctly coming out. And that's my passion, teaching doctors 20 years on how to get accumulated toxins. Those are the toxins that stay around too long, meaning years. They store up, they bioaccumulate in our bodies, in our tissues. And then one of the first things to go is the thyroid. You know what we call the thyroid? The canary in the coal mine. Now, those of you who are my age, you understand that that was an analogy. They would literally bring canaries in coal mines. You know why they did that? Because if there was toxic releases of gases, which happens in mines, the canaries die first. They're that sensitive, like the thyroid, and the miners have time to get out. The thyroid, the reason we're seeing the explosion is because it's the canary in the coal mine. So many toxins affecting it. But really, it goes beyond the thyroid. It's affecting almost every hormone, and it's affecting humanity at the mitochondrial level, where we can't even make enough energy. And now we have people surviving on stimulants, which becomes so popular. Oh, to lose weight? Oh, now it's Ozempic, which, oh, you lose fat, but what they don't tell you is 50% of the weight loss is muscle and cartilage, and it puts you in a catabolic state, and you end up with something called Ozempic face, where literally you end up catabolic because you're losing the connective tissue, and it ages you prematurely, because that's also the GLP-1 phase, as it should be called, because we can't call it Ozempic anymore. They keep changing all the names. But this is why people can't lose weight. Toxic accumulation. So what are we going to do about it? Keep waiting for the next fad that comes in? Oh, and by the way, there's people that take Ozempic and those type of drugs. Question, when can they come off of it? Answer, never. It's true, because the moment they come off, they gain weight back. Oh, and then some. Because now they're not making GLP-1, which is a hormone in their body, just like all the other hormone traps. There's a time and a place to take a hormone. I'm not telling anybody on this channel. Your body stops producing its own hormone, thyroid hormone, and now you need more and more of it if it's even working at all. The point is, get to the big cause, and that's what I want you to hear. And we start by the things that we're using every day that contain these chemicals that are persistent, accumulating in our cells, and now nothing works. Change those habits, and you can change your health and your hormones.